More people are opting to get their operations performed outside a hospital, instead choosing an ambulatory surgery center for their procedure. A sharp rise in the number of these outpatient centers and types of surgeries that can be done in them is exposing some risks when it comes to life-threatening complications. The USA Today Network, along with Kaiser Health News, teamed up in a wide-reaching investigation. A sweep of public records found surgery centers have risked lives by operating on frail patients, sending patients home too soon, and skimping on life-saving training and equipment. The result is often heartbreaking.
It's the most awful feeling you could ever have as a parent. To take your kid to a routine procedure and drive home 4 hours later without him. Our world is rocked forever. It seemed like a simple process. You take your kid to the doctor, get the surgery scheduled, you go in, and a lot of times by 10 o'clock in the morning you're back home, and you're giving them popsicles, getting them rest, make sure they're drinking.
We prayed with him before we left the car. We checked him in. We waited with him in the room. And then they wheeled him away and we went to the waiting room. And it wasn't maybe 20 minutes later, someone came and got us and led us to a room. We went through hallways that had mops in them, and our surgeon said, "This is not going well." She told us he had coded and they'd called the ambulance.
There's no way we know whether the surgery center model is more dangerous than another setting like a hospital, because we don't have any information about what happens in those surgery centers. How many patients got infections? How many were subject to medical errors? How many of them died? How many of them were transferred to a hospital?
We were watching them work on our boy, and one nurse would talk to us, and then the doctor said it was done.
Ruben's death was one of more than 260 we counted from looking at Medicare inspection reports, court records, autopsy findings, and paramedic logs, all from the last 5 years relating to surgery centers across the country. Dozens, including children, lost their lives after even routine procedures such as colonoscopies and tonsillectomies. For the most part, these incidents receive very little attention.
The current information that we have available from ambulatory surgery centers is totally inadequate. It does not inform the public like we should be informed. It does not help patients make choices about which provider to go to, and it does not actually provide the oversight agencies enough information to know whether they need to go in and check out if this surgery center is having a problem or not.
In fact, emergency transports from surgery centers to hospitals are left to self-reporting and many times are checked at zero, even when ambulances have been called to pick up patients.
When you ask someone to report on themselves, sometimes they're not going to be completely honest about it. And the same thing is for surgery centers. There may be transfers that aren't being reported. Maybe they're doing it to protect themselves from looking bad. But what you need is accurate reporting. And it's really hard to get accurate reporting when the reporter is responsible for the harm.
Frank Gluck of the News Press honed in on Florida and found at least 335 life-threatening or fatal incidents since 2013. That includes 80 deaths. His reporting revealed that many centers are offering more complicated procedures, and their medical teams are not always prepared to handle adverse events. 2 patients of a Southwest Florida clinic claimed in court documents that doctors sent them home too early following botched cosmetic procedures. Lee and Collier have a combined total of 41 ambulatory surgery centers. You can explore the full series along with interactive features and lawsuits filed in Southwest Florida by going online to news-press.com or naplesnews.com.